show you how to do CPT and cough assist for spinal muscular atrophy. I use the mask of the cough assist to be my pounder. There's actually this little cup that you can use, but it's pretty firm and really uncomfortable for my daughter. She's never really liked that, so this is a lot more comfortable, and usually it's what they use in the hospitals when they can't find their little cups. And some respiratory therapists prefer this. Big disclaimer, I am not a respiratory therapist, I'm just a mom, and I just am doing what they have shown me to do at the hospital since she was 4 months old, and we spent 2.5 months in the NICU, so my husband and I were really well trained on how to handle her in an intensive care situation. I'm actually in my home, and she's just recovering from being sick. She is on currently about 8.5-9 liters of oxygen, and it's hooked up to her pulse ox. She's on 24-hour BiPAP. Right now she is 18/8. Her normal is 16/6, but when she's sick, they have an alternative setting for us that just gives her more support. She's on continuous feeds right now. That's a little easier for her to deal with. She was doing vomiting and stuff like that, but we took care of that with nausea medicine, and we kept her hydrated, so now she's just eating, and we're going through necessary precautions to keep her out of the hospital. This is what they'd be doing in the ICU. It's just they've given us all the machinery to be able to do a ton at home, or else we'd always be in the hospital. And so right now we're at a point where we can still take care of her at home, but she is borderline of, okay, we need to take her to the hospital, okay, we can be home. So we really have to monitor that really carefully. We do that by making sure we're doing the chest percussion therapy as she's getting sick. It's morning and night, and as we need to increase, we go to every 4 hours, and sometimes every 2 hours if she's getting really critical. We're about every 3 to 4 hours right now, but we're on the up end of being sick. To do CPT and the cough assist with all the suctioning, it's 30 minutes of CPT. And so you go through 10 areas of the chest area, 3 minutes each. If you're in the hospital, you'll have respiratory therapists who will be lazy with it. Not every respiratory therapist is created equal, I have learned, and so if you're getting a respiratory therapist that's just really being laid back with the CPT, request a new therapist. I mean, it's the life of your child on the line, and especially with the newer respiratory therapists, they don't have much experience with SMA because they're not getting as many patients in their units, and they also have a vest that can be put on the child and can shake them for 30 minutes. I am a movement specialist, and my personal opinion, that is not beneficial to helping your child in their milestones in movement, and so I don't do it with my daughter, but that's just my opinion, and based off of the movement sciences that I've learned and know about. And so in this video now we're going to get into, I just want to show you how I do her procedure, just to give other parents insight who have very high needs SMA children, of just a way that this is taken care of at home. And so you're going to see my other kids coming in and out, not all of them, some of them are at church, but you're just going to get a real home setting. And as I go throughout the video, I'll just be, talking things through, giving you tips and things like that. And so, I mean, you can fast forward through it, or really at this point, you'll get the gist of what I'm doing. But especially starting, what the critical part is when you're doing this cupping, it's really important. You can see with this cup that it's sealed all the way around, and so that's why they will put, respiratory therapists will put tape tape across here to help seal that, but your 2 fingers do work. It is tiring to do this for 30 minutes, and so I do alternate with hands. And so as we get into it, one of the big things as you come in and do this, you want to be firm and frequent. And so if you're in the hospital and if you're getting a therapist that's kind of doing this and they're just being lazy about it, like, you need to request a new therapist, ask them to be more firm. I have had tons of situations where I literally had to redo the whole treatment because the therapist was just awful. And so you want to be firm. There's 10 areas of the body. You have the upper and lower lobes of the front of the chest, so that's 4 areas, and then the upper and lower lobes of the back of the chest, which is 4 areas, and then you have each individual side of the chest, which is 2 areas, so that 4 plus 4 plus 2 is 10 areas. 3 minutes in each area will be a total of 30 minutes doing the CPT. So I'm going to go through, do this. I'm going to, because I've got you on the timer here, I'll use that to help me gauge the 3 minutes. What's really important as you're doing this is that you're getting that pounding sound. You can see how this is sealed. When it's sealed and it pounds on your child's chest, the air inside here is becoming a mass that is going through the lungs and vibrating it and breaking up the mucus. At least that's how a respiratory therapist explained it to me, so that's the best that I can give you of exactly what is happening. But the whole point of this is to break up the mucus in the lungs, because especially when the SMA child is sick, they're not moving very much, and so this is to break up the mucus, and so you can get the mucus out. For a typical child, because we're moving so much, even you or I, you're constantly spitting throughout the day, and you're moving, and you're just naturally breaking up all that mucus and spitting it out. But if it gets stuck in the lungs, it can cause pneumonia, it can cause collapsed lung, it can create more intense sickness, and it can lead to death. It's really serious if you don't get this mucus out of the lungs. I think this is really disgusting, but because it's my own kid, I'm doing this. If I had to do this on anyone else, I'd tell you no. That's why I never wanted to be a nurse. I always keep some wet wipes handy. It just helps keep the area clean and keep her face clean, because it's gross to get drool all over. I also have some distilled water here to keep my tube clean as I'm working. Did you bump your bean, buddy? I have her hooked up to her pulse ox, watching her vitals and things like that. Right now her oxygen is at 91. Before I just got started, she was dipping down into the 80s, and so that's just letting me know that I need to do a treatment and just get the mucus out of her lungs. And also too, when you're working with your kids and stuff like that, you can forget where you're at with your time, and so it's okay. The important thing is that you do at least 3 minutes everywhere. It's really important that you are not lazy on this at all. Can you take So my husband is here. I'm gonna try and let him play with the littles. I guess since she's leaving this side of her chest open, I'll work on the side first versus the top. And I got about a minute and a half up here before I need to section her, so I'll come back and do that. earlier, it's really important that you're firm and frequent. You're hearing the other machinery in the background, but I also just want to give that real home setting. I mean, I've got oxygen concentrators on, and there's some books. To give you a little bit of history and background, she is SMA type 1. We've been on Spinraza since she was about 2 months old. And when she was born, she was pretty weak to begin with, had a weak cry, her tongue tremors. We had no idea what was going on. She didn't move, but just worked with it. My first pediatrician just said, kind of, let's wait and see. Another mom in the area had a son with SMA, knew the signs immediately, said, go see my pediatrician, because he saw her son. So he was familiar with SMA. We went and saw him, and sure enough, it was SMA. He sent us to the Children's Hospital, and that was March 1st. They told us that the FDA had just approved a drug on December 25th from the previous year to stop the progression of the disease for SMA. And so we would be, technically we were the second case in the Children's Hospital. The first case was there, but they ended up moving to Italy, so the child didn't get all the loading doses and stuff like that. So we were the first case that really they were able to monitor, and that was the first case that was not on the trials. And so they had no procedures for how to get the medicine, things like that. They didn't know what was going to go on. And she also, my daughter, couldn't swallow very well, couldn't eat, so we were scheduled to get this was a Wednesday when we came in. We were scheduled to get to do G-tube surgery that next Tuesday. And we were there Wednesday, Friday. They said, do you want to go home or do you want to stay here for the weekend? And I was like, I have no idea what I'm doing. How am I going to feed this kid? Yeah, she has a G-tube in, a nose tube in, but what if it comes out, or what if something goes wrong? 5 minutes to get to the hospital could make all the difference, and I don't know what to do. So we opted to stay at the hospital until the surgery, and I'm glad we did, because that Sunday she went into respiratory failure. Her carbon dioxide levels were at 114. They were trying to do BiPAP with her. They should have taken her down to the ICU, but they didn't. And we ended up, going down to the ICU. They had to intubate her, and so for all of her loading doses, she was intubated. For all the loading doses, she was intubated. And sometimes you just have to hold the arm so that you can get your spots. It's sometimes annoying when she fights it, but at the same time, I will take the fighting over no fighting, because I've been there. But anyway, we were in the hospital for all the loading doses, and during that time, we were in the ICU for 2 months. And then, just had to learn how to take care of her, had to learn how to do CPT and cough assist. They wouldn't let us go home without learning how to do that. There's actually, we don't do it as much with her now because she can cough on her own, but we had to do a lot of deep suctioning, which is going down through her nose and going deep into her throat to get the mucus and things like that, which they weren't going to teach us that to go home. And I said, well, yeah, you will teach me, because I see you do it every day with her, and I probably should know how to do that, or else I'm going to end up in the hospital all the time. And just a story to relate to that, we were in the hospital once later for one of her checkups, and a mom was trying to suction her kid, and he was choking on his spit, and she was trying to use this little nozzle nose thing to get him, and I'm like, he needs a deep suction. you're not going to help him with this little nose deal. And I was like freaking out for the mom, but thankfully there were nurses there. They helped stabilize the kid. And so, that was just a necessity I knew for us, that I needed to learn how to do suction. And so, we were at the hospital, came home. I had to do this every 4 hours, day and night, so I was exhausted for a very long time, trying to keep up with this until she got better from she got RSV, and so that's why we were in the hospital for so long. And then she had the SMA, and so we just had a really hard time getting her off the breathing machine. She really just couldn't do it on her own. I knew every time she was going to be re-intubated, because it looked like the air was crushing her. And the fourth time we were going to extubate, we decided not to re-intubate, so a DNR, do not resuscitate. And thankfully, during that time, I found a lady named Michelle Turner. I just found a YouTube video where she was showing how a baby moved from 0 to 1 month, and I was like, oh, where was this video? And I was trying to figure out how babies move. So I, called the lady and asked if there was anything she could do to help my child, since, everyone else said there wasn't really physical therapy that you could do for a 2-month-old or a 4-month-old, I guess, at the time. Like, I mean, you could move their arms and stuff like that, but there wasn't a ton that you could do, especially with an intubator. And the lady, she said, well, you need to help your baby breathe. And I'm like, how do you do that? She's not even old enough to hold her breath. She can't increase lung capacity. And so she sent me an exercise of working on an adult, and I was like, I don't get this. So I showed her how I was trying to implement the exercise on my daughter, and she said, no, you're doing it wrong. So she showed me another exercise that was on a dummy baby, and I did that exercise, and because my daughter was hooked up to all these machineries, I could see that something internally had happened to my daughter. She wasn't working so hard to breathe. She suddenly had a normal heart rate, and it was amazing. You could see that she was not stressing out to breathe. And so when we extubated her, I continued to do the exercises, and we made it through that hospital stay and was able to go home, and I 100% attribute her life. One of the critical things was to doing what this lady told me to do, and later I learned that it was a modality called movement lesson, and it was based off of movement sciences and how you move, and that there's a specific process that babies go through to learn movement and development. And I was, as a mom, frustrated because I didn't even know when my daughter's milestones would happen, if they would ever happen. And this lady was like, well, you can give them to her, but you can give them to her, I don't know if vicarious is the right word, but you can give them to her vicariously. Even if she never performs them, you can still give her the experience of all these milestones, and let her brain and body experience exceptional development. And I was like, well, I'm in, because we can't even do tummy time, so whatever movement input she needs for tummy time, I'll teach it to her. Whatever she needs for rolling over, I'll do it for her. And the point at which she shows the performance of any given milestone is very late. In the last 6 months, she's just really been doing a lot of tummy time, where she can lay on her tummy and get her head up on her own. She's 5 years old, and I'm getting tummy time at 5 years old. And a newborn baby can do that within the first month of life, at least for a few seconds at a time, and it just really increases quite dramatically. A newborn baby has head control, and we didn't get that for quite a while. But coming in and doing this stuff, one of the big things when we came into the hospital attention, like, my baby's not coughing or sneezing. Like, it never occurred to me that she never had. And when they asked that, I knew the answer, that she never had, because she just never had. I'd never seen it. And a brand new baby will cough and sneeze from the first day of life, and she just never had it. So they were like, oh, we've got to do the CPT and sectioning and do all this stuff. And I was like, well, okay, teach us what to do. And I remember being with movement lesson and going in for an intensive, and one of the first dramatic things that I recognized that movement lesson did for my daughter was teaching her how to cough. And we were sitting there in a lesson, and Michelle was working on her, and my baby self-coughed on her own. And I was like, what? She just coughed on her own, and every day since. Julia has been able to cough on her own. Now, when she's really sick, it's a lot more difficult, and so I have to continue to do this. It's just been in the last year where when we're doing this, when I'm having to do CPT and sectioning and cough assist, where I can be like, okay, give me a big cough, and she can actually cough strong enough to get the mucus and stuff from deep in her chest and get it up to where I can reach it without having to go through her nose. And so that's only been a recent development, which has been a lot easier for her, a lot less traumatic on her nose. You have to be really careful doing deep suction through the nose, because you can get it bloody and things like that, and it's just not fun, and it's uncomfortable anyways, and so because of movement lesson, I've really gone from the most intensive care for my daughter to really quite minimal. I don't have her on pulse-ups all the time. I don't have her on oxygen hardly ever unless she's sick. I don't do CPT and cough assist every day. I mean, doctors still tell me to do it morning and night. So me choosing as a parent doing that, I feel like it's more detrimental than helpful. She fights it, and on the other end, I'm also teaching her how to breathe, how to cough, how to self-initiate those things for self-care that I just don't feel like it's needed. So that's my personal opinion. Don't stop doing that. Do what your doctor says. Don't do what I do. I just am letting you know what I do, being honest and upfront with this. But from her doctors, they said, had we not known any better, that your daughter was a severe type 1 and was doing the worst out of all the cases that came in to do the Spinraza, we would have thought she was a treated type 2, and she is doing better than any of the other cases, any other of the batch of cases they had come in around the same time as her getting the drug. There was actually there was a couple other babies that were in her same condition, much stronger in a sense. They weren't on life support when they started to lift up their legs, things like that. But she by far has surpassed the abilities of those children. She actually can sit up, she can use a walker, she can use a self-controlled wheelchair. She can sit up for long periods of time. She uses her feet as a second pair of hands so she can lift up her legs. She talks really well. She can read. She has a wicked brain for memorizing stuff. But all that I attribute to movement lesson, being able to take her through the milestones, and then as whatever she's capable of, to be able to have independence in movement. Movement has allowed those abilities to shine forth that just wouldn't otherwise be possible. I haven't followed traditional therapy. I did have PT, OT, and ST come in at the beginnings of her life, kind of ask for direction of what their plans were to help her succeed. And for the PT, he said, well, we want to help her have head control and then, work from the head down. And so I asked Michelle, I said, what do you do for head control? And she said, well, you work on the pelvis. And I was like, pelvis is not up here by the head, but okay, I'll try it. Like, I saw what it did for breathing. I'm going to try and work on the pelvis. And lo and behold, like, we started getting head control. And I know that had nothing to do with the PT, because he just came back the week after he came back. He's like, wow, she has a lot better head control. And he was up here at her shoulders trying to balance her, and I had worked on her pelvis, and there was just a huge difference in her ability to have head control. She was able to create that movement on her own versus someone just having to manually balance her head. And so it just, I eventually just discontinued the therapy services because I could do more in an hour, even at my limited knowledge and ability. And my primitive ability to do movement lesson, I could do more in an hour than any of those therapies could really do in weeks and months of working with my daughter. And so, I just invested my time to do movement lesson and to do things that improved her movement. I don't do AFOs or I don't use her in the standard because those things restrict rotational movements, which is what movement lesson is doing. Movement lesson is putting rotational movements into the body. And she's just done amazing with it. But that's just been my personal choice. But I've just seen, out of everyone else who does the traditional therapy with their SMA kids, she by far surpasses just the abilities of so many, and she does it with more ease. We don't have contractures, and she just really moves really well. And that's more just to let you know of what she's done, and that's not doing traditional therapy. It's really just doing movement lesson. Movement lesson is my base, and then I do some muscle activation. My husband learned that technique, and so we use the two hand in hand. And then in the beginnings, I did cranial sacral because I didn't have a movement lesson practitioner nearby me, so I felt like those two worked really well together. So I would do the movement lesson at home, and then I felt like the cranial sacral supported it, so I did that because there was one in a practitioner in my area. And I went and did my first intensive with Michelle in Arizona. There was a muscle activation specialist, so I went to him, and I didn't know it at the time, but he worked a lot with her ability to breathe and things like that, so continued and helped in creating that ability for her to cough. Movement lesson just helped her maintain and keep that ability versus having it just be something that was fleeting. And then we bought a pool but haven't been able to use it yet, so I've been sitting on it for 4 years, and we actually just got it installed 2 weeks ago, so now we get to start doing stuff in the water with her. But just as a caution, when you are using water, water can take away rotational movements if you're not careful. And so thankfully, by divine intervention, I didn't have that as available to me, because I would have put her in the water all the time and would have actually been more of a hindrance to her. Because the big thing with movement lesson is you're learning how to create how to help your child move in gravity. Milestones and movement is all about the relationship that we create with gravity. And we should be able to move through gravity instead of gravity pinning us down. And we really see that with our SMA kids. You see it when the face starts sinking because of the BiPAP, or because they're laying down.